Welcome to the third installment of the Matriskin brand training. So we're going to look at the remaining ranges in the Matriskin brand, specifically focusing on the enhancing program and the eye care program. So the enhancing program is specifically indicated for highly reactive skins that have an impaired barrier function, patients that have a really dry, sensitized barrier, redness in the skin, and that lack epidermal lipids in the skin. So the enhancing program is absolutely perfect for patients that have significant chronic inflammation. This could be patients that have a lack of emollients in their skin, patients who are losing moisture faster than they need to, and where the patient's skin has artificially been put into that state. So your post-procedure skins, patients who have had a non-ablative or ablative procedure where their skins are compromised for a shorter period of time, the enhancing range is going to be for those kinds of skins. So the first product in your enhancing range is your CR7 cream. This is a restorative cream indicated for injured skins. So this would be your post-procedure skin that you would utilize following a aesthetic procedure, whether that was a chemical peel, a microneedling procedure, non-ablative or ablative laser procedure. The CR7 cream is specifically indicated for patients that has an impaired barrier function as a result of a procedure that's been done, significant acute inflammation, redness, swelling, sensitivity, and it's basically indicated to enhance the healing process, to create a barrier on the skin where the barrier has been removed, and to alleviate or inhibit specific irritation in the skin caused by this procedure. One of the key active ingredients in this product is dimethyl isosorbide, or DMI, a high purity solvent carrier, which is a carrying system to enhance the delivery of active substances into the skin. So this ingredient has been discussed previously. It enhances the penetration of specific actives into the epidermis. It also improves the shelf's stability. It improves shelf stability, so shelf life, and enhances the stability of the product. Basically, this is a delivery vehicle for the active substances in this product that's going to benefit the deeper layers of the skin. Vitamin B or panthenol is a common ingredient used for post-procedure skins. It's one of the best as it plays an important role in repairing damage that has been done to the superficial barrier in the skin. It repairs the cutaneous barrier, increases hydration in the skin, and decreases inflammation, which is what you want after your skin has been injured in a procedure. D-panthenol also stimulates cellular growth, so it can enhance the proliferative phase of wound healing, making sure that the skin improves quickly after there has been an injury in the skin. Due to its hygroscopic nature, it improves hydration in the skin and also creates a barrier which prevents transepidermal water loss. Your growth factor from plant or origin, which has been discussed before, is your Nicotiana enthymiana, SH polypeptide 7. And this is a plant-derived growth factor ingredient, which is going to enhance the repairing mechanisms in the skin for patients that have had UV damage, patients that have acne-prone skin, damaged barriers, or skin irritation, perfect for patients who have had a procedure. This ingredient is also an excellent anti-aging ingredient, improving fine lines and wrinkles, boosting collagen synthesis, reducing the texture and the color of aged spots, improving the texture in the skin, and improving elasticity in the long run. Sodium hyaluronate, which is a common feature in the Matriskin line, is a natural hydrating ingredient that mimics hyaluronic acid, and prevents transepidermal water loss. It sits in the superficial layers of the skin to immediately provide comfort, improve redness and hydration, and to prevent more moisture loss from the skin. Your biosaccharide gum is a natural polysaccharide which is obtained from biofermentation, and it provides an extra or second skin effect on the skin. So it gives you an immediate relief from dryness and dehydration, limits external aggressions on the skin, which is important in a patient that has had a procedure, and also reduces the effect of heavy metals and pollution particles on the skin. It is non-occlusive, so although it feels very nourishing and immediately provides comfort, it will not occlude the skin and affect the acid mantle in a negative aspect. Your oleic acid is a monounsaturated unsaturated fatty acid. It's an omega-9, and it basically mimics the emollient action of your natural epidermal lipids, reduces water loss, improves skin barrier function, and basically enhances the integrity of the cell membrane. So your CR7 cream can be used as often as needed following a procedure for 3 to 5 days, depending on how ablative the procedure was, and it should be followed with a good sunscreen. This is an example of the type of skin that would benefit from using CR7 cream. Looking at your HPR mask, this mask is indicated for your inflammatory acne conditions. It's a hydrating and soothing mask, so it will not dry the skin out. It'll improve the skin's ability to protect itself against moisture loss, enhance desquamation in the skin, and provides the skin with the anti-inflammatory soothing benefits it needs if it's got significantly inflamed acne lesions. Kaolin is also going to improve the mattifying effect that you get from this mask by absorbing excessive sebum in the skin. It also contains your biosaccharide gum, which is essentially going to restore moisture to the skin without creating an occlusive effect. Your kaolin is a microparticle mineral powder, and this mineral powder has exceptional absorption capabilities. It also draws impurities from the skin as well as dirt and toxins, and it mattifies excessive sebum production on the skin. So this can be used by patients that have grade 1, 2, 3, or 4 acne. It can be used 2 to 3 times a week, left on for 10 to 15 minutes, and ideally a exfoliator can benefit the benefits of this mask once it's applied. You will apply it, wait for it to dry, and then rinse it with water. It also contains your cucumber extract, which is exceptionally cooling and soothing on the skin. It's going to really improve inflamed and irritated skin and enhance hydration in a very dry or very compromised skin. Your eucalyptus leaf extract is, as we know, exceptional. It has exceptional antimicrobial properties. So it has an antiseptic effect and will reduce excessive proliferation of bacteria on an acne-prone skin. It's also got a really refreshing effect and purifies the skin by cooling it. Your ginkgo biloba is used for its therapeutic benefits. It is an excellent antioxidant and improves nutrition to the cells. Macadamia seed oil is an excellent ingredient that reduces excessive sebum production, but at the same time mimics your epidermal lipids to create and enhance a good quality skin barrier function, which is a common concern with patients that have acne. They tend to lose moisture rapidly because they are using very harsh ingredients on their skin. They tend to have excessive inflammation as a result of the blockage of the follicle and the proliferation of bacteria. So this has got an anti-inflammatory effect and it reduces sebum production. Palmitic acid is a emollient ingredient and is particularly good for patients that have inflammatory skin conditions such as psoriasis and eczema, and soothes the area that has the acne lesions. As mentioned, this mask can be applied and left on the skin and should be rinsed, and then should be followed with the correct home care products. So make sure that you can identify or diagnose the grade of acne accurately. This mask would be ideal for any reactive skin and can be used in any grade of acne. Now, when looking at your patients that has a extremely dry, sensitized skin that feel like their moisturizer is never nourishing enough, the RL3 cream is a replenishing lipid-based moisturizer for your oil-dry patients. These are for clients who have a deficiency in epidermal lipids. Their lipid bilayer is defective or influenced negatively. Great for patients who have a dry skin as a result of medications such as cholesterol medication. Excellent for menopausal clients who find that their skin has become extremely dry, and it can also be used as a post-procedure product following semi-ablative or non-invasive treatments. As we know, biosaccharide gum forms a second skin effect and enhances nutrition and hydration in the skin. It is a non-occlusive humectant, so it is going to reduce transepidermal water loss without clogging the follicles or the pores. Hydrolyzed marine collagen adds an additional benefit to this product in the sense that it's going to enhance the production of collagen in the skin. Patients generally that suffer with a poor production of glycosaminoglycans have a poor production of collagen, and they have a poorer quality of collagen as they start aging. Hydrolyzed marine collagen is going to enhance collagen production, and it's also going to protect and preserve collagen in the skin in patients that have aging concerns. Your sodium hyaluronate is going to prevent transepidermal water loss by sitting in the surface levels of the skin, where it will immediately provide comfort, reduce redness, and sensitivity. Your vitamin E is a powerful healing antioxidant free radical scavenger. It slows down aging by limiting free radical damage. It's exceptionally healing. It speeds up the natural healing mechanisms in the skin by enhancing microcirculation and the hydrolipidic film. So it basically mimics your epidermal lipids, and it sits in the surface of the skin in the superficial layers to reduce water loss and to increase that comfortable feeling that you get when your skin is well hydrated. It is essential to the body and will speed up the production of epidermal lipids. As mentioned before, it's a free radical scavenger, so it's going to slow down cellular aging. Your octadecyl PCA is a wonderful carboxylic acid ingredient. It basically reinforces the cutaneous barrier in patients that have a dysfunctional barrier function, whether that is from a disease like eczema or psoriasis, or whether the patient has been using the incorrect products or had a procedure that really damaged your skin. This ingredient is basically going to provide you with biomimetic factors that will strengthen the structure of the stratum corneum so that you don't lose water as quickly, so that your skin stays soft. The wonderful aspect about this ingredient, it does not increase the sebum production, so it can be used on normal skins as well. Your propylene glycol, which is a extract of chamomile, is specific to the peony plant and is a protected species in China. White tea is a flavonoid which basically provides an incredible antioxidant benefit in the skin, and it's going to stimulate microcirculation to provide relief from tired and stressed skins. Macadamia seed oil again reduces excessive sebum production and stabilizes the lipid balance in the skin. It improves the lipid bilayer and acts as an antioxidant to reduce the signs of aging. Your RL3 cream, as mentioned, can be used morning and evening on really dry, compromised barriers or patients that have aging concerns where they have lost moisture or they find that their skin has become drier over the years. Now, your RL3 serum is your oil-based serum, which is excellent for patients that find that nothing they ever apply to their skin is enough. They feel like they pile on the moisturizer and the serums and it just gets absorbed into the skin and it doesn't provide them with any relief. This is a really quick relief from exceptional dryness because the texture of the serum has an oily base. So it absorbs really effectively into the skin to plump and hydrate and just provide that epidermal lipid benefit for patients that have an extremely dry, compromised, and irritated skin. Vitamin E is a powerful antioxidant, as mentioned before, increases microcirculation and immediately activates the natural healing mechanisms in the skin. Your octadecyl PCA is your non-greasy hydrating ingredient, which basically enhances the structure of the stratum corneum so that it provides a better protection against moisture loss, and it enhances lipid synthesis in the superficial layers of the barrier. Your white tea extract, again, is going to provide you with antioxidant healing benefits that's going to provide you relief from stressed or tired skins. Your canola oil is rich in omega-3 and 6 fatty acids, which mimics the natural composition of our epidermal lipids. Patients who have a deficiency in epidermal lipids as a result of disease or medication or simply age-related factors will love this ingredient because it has a particular affinity to the skin because it mimics the natural epidermal lipids that we find in the skin. So this is really what makes this product so compatible to the skin, and the fact that it shows improvement so quickly is because the canola oil or the omega-3/6 fatty acid structure mimics the natural epidermal lipids in the skin. Your rubus IDS seed oil is also rich in omega-6 and 3 polyunsaturated fatty acids. It reduces aging in the skin, enhances epidermal lipids, and basically plays a role in assisting in the restructuring of the stratum corneum when it is deficient in protecting us. Your sesame oil is rich in essential fatty acids and specifically vitamin E to protect us from inflammation in the skin and dehydration. It basically fills up the cutaneous lipid deficiencies in the skin, hydrates, and it protects. Your wheat germ oil has very, very long since been known for its absolutely amazing regenerating properties. It enhances the emollient action in the skin of this product. It basically provides you with an exceptional healing ingredient that is very, very rich in vitamin E and gives you excellent antioxidant properties because vitamin E is a phenomenal free radical scavenger. So this is ideal for patients that have an extremely dry skin, lots of environmental damage, or for patients that have a really stressed skin that's been going through a lot of difficulty or they've had procedures done and their skin needs extra nourishment to heal. This is the perfect serum and can be used morning and evening. Can also be alternated with your hyaluronic acid serum during the day because it is quite rich and they might find that their makeup won't absorb effectively if they apply this during the day. So this can be used as a nighttime serum, and it can also be combined with our other serums. So excellent for your clients who have a very dry, reactive, and dehydrated skin. So let's take a look at the eye care program. So your eye care program is probably Matriskin's claim to fame. It is the most amazing range of eye products that targets every single concern that your client might have around the eye area. Now, the eye area is quite a fragile area. We know that the skin around the eye area does not make any sebum. There's no sebaceous glands. There is a natural deficiency of hydration around the eye. The skin around the eye is exceptionally thin and therefore is the first place to show aging on the body and on the face. There's various different really serious signs and symptoms that can cause significant distress for the patient around the eye, which includes sagging, excess skin around the eye, crow's feet or lines and wrinkles around the eye, dark circles and puffiness. So there's quite a lot of concerns that we see commonly around the eye area, and Matriskin provides a solution for every single concern that you might have on that area of the face. The first cream we're going to talk about is your eye contour cream. This is a rich corrective care cream for the eye area, which basically stimulates the proliferation of new cells to enhance cell renewal. It fills deep wrinkles and enhances the hydration mechanisms around the eye area, which is deficient when we start aging. Jojoba esters, hazelnut peptides, hyaluronic acid, and lipids will all work together to increase hydration and to enhance the elasticity around the eye area. It also contains biosaccharide gum, which is a really nice non-occlusive hydrating ingredient, which will immediately provide you with a lipid effect on the skin while absorbing very effectively into the skin. Your hydrolyzed hazelnut protein is a wonderful ingredient. It stimulates cell renewal and increases the keratinocyte and fibroblasts proliferation. So it enhances collagen production, enhances the protection of the skin cells around the eye, and also enhances lipid synthesis around the eye area where we have a deficiency of epidermal lipids. It also contains your safflower oil, which is made up of very similar makeup to our natural epidermal lipids. It prevents moisture loss. It mimics the essential fatty acids in our skin to provide a comfortable hydrating effect on the skin. Because ceramides make part of the natural epidermal lipids, this product is particularly useful for the eye area because it mimics the composition of our natural epidermal lipids. Your jojoba oil extract is made up of wax esters, which is extremely similar to sebum. And sebum, because we have a deficiency of sebum around the eye area, we tend to get drier and our skin tends to lose its elasticity. And this ingredient is almost going to mimic the effect or the benefits that sebum has for the skin. So your eye contour cream is going to be for your clients who have a very dry, dehydrated eye contour area that is showing signs and symptoms of aging, excessive sagging of the area, and static lines and wrinkles, as well as crow's feet. This can be used morning and evening around the eye area. Your Eye Perimeter 360 serum is amazing. It is a combination of patented active ingredients that targets the 360-degree elements of the lower and upper eye area. It is particularly good for patients that have excessive skin and sagging around the eye area. The quinoa seed extract is going to enhance microcirculation around the eye, which will have a beneficial effect on dark circles that stem from excessive water retention or edema around the eye area. It also strengthens the microcapillary vessels so that you don't get that drastic constriction and dilation of vessels, which eventually makes them lose their elasticity and results in a permanent darkness around the eye area and permanent edema and water retention around the eye area. Your Albizia julibrissin bark extract is an anti-inflammatory ingredient which is going to fight free radical damage. It also assists specifically for. It's also specifically good for patients that have a predisposed tendency towards glycation, patients that have diabetes, patients that suffer from insulin resistance will benefit from this because it will prevent the stiffening of collagen fibers around the eye area. Your apricot kernel oil has got a free radical scavenging ability and is particularly good for patients that have had significant sun damage. It provides a nourishing and emollient effect around the eye area to make you feel soothed and moisturized. And it also enhances the natural hydration mechanisms in the skin around the eye. Your sodium hyaluronic acid is going to plump. Remember, hyaluronic acid will you'll be able to retain its 1,000 times its weight in water to plump the area and to basically provide a more supple and plumped out appearance of deep static wrinkles around the eye area. It's also going to protect from transepidermal water loss and have a preventative action on aging around the eye area. Your oleic acid, which is an essential fatty acid, is going to mimic the epidermal lipids naturally present in the skin to enhance barrier function around the eye area. And your xylitol is going to increase water reserves and reduce water loss. It's going to enhance the barrier function so that we have more hydration available to us and that we lose hydration less rapidly from the eye area. Okay. Your sesame oil, again, rich in vitamin E, enhances the healing mechanisms in the skin and enhances the synthesis of lipids around the fragile eye area. This product can be applied all over the eye area on the upper and lower lid to reverse visible signs of aging as well as to prevent visible signs of aging to appear around the eye area. Now, Matriskin's claim to fame, one of its most effective and wonderful eye products. This is truly a solution in its own right. I've never come across another product that targets this particular concern around the eye area, which can be extremely frustrating to treat without surgery. Now, the periorbital cream, the no pad periorbital cream, is a very innovative formulation that was developed to remove excessive fatty tissue around the eye area. Often we have permanent puffiness in the lower lid underneath the eye, which cannot be related back to water retention because it's not spongy. This has to do with a fat pad that is naturally situated underneath the eye area. As we get older, we have a certain amount of bone and muscle loss, and we also have a excessive sagging of the skin around the eye area, which can make this little fat pad underneath the eye in certain individuals look more noticeable. So these little fat pads that are visible in certain individuals can be as a result of adipose tissue that is naturally present around the lower lid, but we can also address puffiness that is caused by swelling um, and a weak microcirculation if we use this product because it also attacks and targets water retention and accumulation around the eye area. It basically reduces capillary permeability so that we don't leak fluid into the extracellular space. It improves lymph drainage so that we can get rid of excessive fluid retention. Eye puffiness can result from a number of factors. As mentioned, sleep deprivation, a diet high in sodium, which enhances water retention, crying, menstruation or hormonal fluctuations. These can all combine to contribute and exacerbate puffiness around the eye area. Acetyl tetrapeptide 5 is specifically indicated for inhibiting glycation around the eye area to prevent the stiffening of collagen fibers around the eye area. It inhibits vascular permeability, so it reduces puffiness around the eye area, and is particularly useful for patients that struggle with insulin resistance or diabetes. In clinical studies, puffiness around the eye area was greatly reduced by using this ingredient alone. In 70% of the volunteers that had it, they saw improvement in various different areas. 35% of them saw a good improvement in the skin, and it was visible enough for them to notice that the skin around the eye area looked dramatically different. In some of these studies, you can see over a 2-week period the significant changes that they've had in the skin around the eye area in terms of reducing puffiness, reducing the visibility of that little adipose pad that sits below the eye. Acetyl tetrapeptide helps to drain excessive fluid, and this will reduce eye puffiness. It basically improves your microcirculation and inhibits glycation. It also inhibits vascular permeability, so it reduces the amount of fluid that leaks into the extracellular space. Your palmitoyl pentapeptide 4, as you remember from your high performance cream, this is your product or your ingredient that is clinically proven to increase collagen production. So it's going to firm loose skin around the eye area, and it's going to improve the diameter and the depth of wrinkles around the eye area. In clinical studies, it has 117%. They saw 117% increase in collagen production. Here you can see the visible benefits that the No Pad periorbital cream has on the skin. This is specifically related to the hesperidin methylchalcone and dipeptide and tetrapeptide ingredients that are in this product that smooths eye bags, enhances firmness and elasticity of the skin, and reduces laxity around the eye area. Your hydrolyzed marine collagen is going to stimulate your collagen production in the skin to prevent collagen loss and also enhance new collagen formation. Your vitamin B5 panthenol is your non-occlusive ingredient that is going to reduce moisture loss and basically enhance cutaneous protection of skin around the eye. In these individuals, they have very few natural moisturizing factors, so we need to create a barrier that reduces transepidermal water loss. Vitamin B6 is utilized during fatty acid metabolism and converting that into energy production. So it is specifically going to enhance the metabolizing of fat around that little fat pad that we see in the skin by increasing energy consumption and storage. Phosphatidylcholine is an essential phospholipid that is an omega-6 fatty acid that mimics the natural epidermal lipid composition in the skin. So your No Pad periorbital cream is particularly indicated for any type of puffiness for men and women, whether that's increased adiposity around the eye area or water retention. And that is your full Matriskin line, ideal to combine with any procedural approach in your clinic. Should you have any questions regarding the content we covered in these 3 modules, please feel free to contact us.